Hello, my name is Dale Domenu. I am a 67-year-old Canadian who had a complete hip replacement just over 3 months ago. Right hip, this side right here. Titanium and ceramic hip. This video with exercise suggestions for hip replacement is on two sides. If you're waiting for a hip replacement, I'll explain why this is important. If you've had your hip replacement and you're doing your exercises to get stronger, these exercises will help you. This is a blend of exercises I found on YouTube. I've spoken with physiotherapists and simply have modified and studied to come up with this. If this works for you, wonderful. Pass it on to friends. If you're waiting for your hip replacement, 2 words: stay strong. I know how difficult it is. I, along with everybody else, knows what it's like to go through the pain and frustration of waiting for a hip. My thinking was you could not change how your body was breaking down and the hip wasn't working properly. What you can control is keeping your hip strength strong before your operation. Check it with your physiotherapist, ask them about this video if you like, but the stronger your hip is going into the surgery, the faster your recovery will be after the surgery. And what I do with these exercises is I try and focus on balance, core strength, and hip strength. All of these will help you along. Now, for people that have had post-hip replacement, these exercises are way too hard for the first 6, 8, 10 weeks. But you could try some. At some point, you should be able to do them all. So pre-replacement, do these exercises, get stronger. Post-replacement, do the easy ones that you are told to do by your physiotherapist after surgery, and expect to get stronger as time goes on. All right, enough talk. Let's show you what I do. Oh, first of all, I should ask that elastic bands. What I have for equipment, they make mini bands in different weights. This is the heaviest or the most difficult to stretch. The blue one is lighter, and the red one is even lighter yet. Many of the exercises involving bands can be done in different stages. First of all, do it without any bands. That way you have some tension. Go to the least amount of tension. Go to the one that's next up, and then finally the heaviest. All right, enough talk, Dale. Let's do some exercises. The first one, I use my blue band, and it involves standing and trying to get some balance established. Okay, what I do is first of all stand with a good posture. Out, 1, 2, 3. And you're giving yourself a little pause on the outside. Then the other side, 1, 2, 3. I do 15 each side and just hold that balance. By the way, one suggestion, where you do these exercises, do them the same time of day in the same place. And I like to have music. I don't have music now, but it would help. Next exercise, balance. Counting 1, 2, 3. I count a little longer. To the side, 1, 2, all the way back. And this is important to engage your cheek muscle, your gluteus maximus, your bum muscle. You want to get this nice and strong. Switch legs. By the way, I do everything left and right side because you want to keep your non-operated side as strong as you possibly can. And back and hold it. So do 5, do 10, do 15, do 2 sets of 5. Next, I use my black band and I do kickbacks. By the way, I know I'm bending beyond 90 degrees, and post hip replacement people, you know all about that. Then what I do is try and hold it. 1, 2, 3, 4, switch sides. 1, 2, 3. That's the one there. That's with the band. This is just a piece of rubber band that I have, and what you do is you balance on the side that's closest to where you have your attachment. Get your balance. 1, 2, 3. This works on keeping your balance. There's no strength element in this. And then you switch sides. Side closest to the band. 1, 2, 3, 4. Okay, let's go down on the floor. I'll explain about the ball, the exercise ball, in a second. This is a hard one. This one hurts. Don't do it unless you really feel strong enough. Brace your elbows. This is what they call a plank with a difference. 1, 2, 3, 4. Switch sides. 1, 2. And you can add your count for as much as you want. This is my cat who likes to work out with me. Biggie. Bird dog. Important one here is to scrunch your cheeks, your gluteus maximus, once you have it out the back. 1, 2, 3, 4, 5. Switch. 1, 2, 3. And you should feel the tension in your lower back. Next one is an important one. And for people who are pre-op, you should be able to do this on your side so that your belly button is like a flashlight and you want it pointing this way. Point your toe forward. Now you'll know you're doing this right when you can feel the cheek of your gluteus maximus right there and hold it. Hold, 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 hold. And then I reverse it. Other side. And hold it for a count. 1, 2, 3. Now it's time for the ball. Exercise balls, by the way, are easy to find and cheap. Here's the easy way to start this. Put your hands at your sides and roll the ball with your heel towards you. That's the easiest one. A little bit harder is when you have your elbows only. And if you could really get good, and I'm not really good, is you lift your hands off the floor. So both sides. 2, 3, 4. And you're bringing this ball towards you. Still on the ball. Hands at your sides. Start here. And wiggle back and forth. This is the easy one there. It's a little bit harder if you go just with your elbows. And this is the one I try and do. I'm losing it. You're working at your core, trying to keep your balance going. Still on the ball. The easy one, raise one foot off, hands at your side. Next level up, at your side. And the third progression, this is the one that works the best, is 1, 2, 3, switch sides. 1, 2, 3. As many of those as you like. We're still working at getting our lower back strong. With the ball, now the further you put the ball back in your feet, the easier this is. You put it here and lift your leg, it's easier. If you move the ball more forward, so it's right below your hands, this is a little bit harder and better for you. And hold to a count of 1, 2. 1, 2. 1, 2. Other side. 1, 2. 1, 2. 1, 2. You're strengthening your lower back and especially your gluteus. This is my show-off move. You don't have to do this, but it looks good. Roll yourself forward on the ball. Brace yourself on your elbows. Feet together. Dolphin kick. You can do as many of those as you want. This next one I like, especially if you want to work at so you need to be up against a hard surface so your feet can brace. And the ball's right against your thighs. Lean forward on the ball, cross your arms on your chest, raise one way, raise 2, raise 3, raise 4, raise 5, raise 6. I forgot to mention one more little piece of apparatus. This is a kid's soccer ball, 10 inches across roughly. You can find these in a thrift store. Someone will have one of these they're throwing out. And this is a really handy ball to use. Between your knees, squeeze it a bit, hands on your chest, and roll forward. Touch your knees to your elbows. I do 15, You can do 5, you can do 10. And then the second part of this is to cross. Reach across. 1, 2, 3, 4. You can see what I'm doing. You're twisting your upper body to work it. Blue band, which isn't a heavy one. This is a side bend. 1, 2, 3. Now, if you're post-operation, this is going to be hard. This is my operated hip, the right side. When you lie on that side, it'll be tender for a while. But you're doing side leg raises. Next one, I switch over to my black band. And there's 2 exercises here that strengthen the hip muscles in your sort of body core. If you can do this one, fine. I'll show you an alternate one. This is what they call mountain climbing. And this is why I'm wearing socks, by the way. Is you'll find it easier on a slippery surface to do this exercise, to let your feet slide. So mountain climbing is this. You bridge yourself. 1, 2, 3. See, I'm not slipping on this carpet. Anyways, move your feet back and forth as strongly as you can. If you can't do that one, you can do this one. Lying on your side, band around the instep, bring it forward. 1, 2, 3. Other side. 1. Easy. This is one for a long muscle in your body called the TFL. Toes pointing this way. You actually can feel it on your hips here where the muscle connects to the bone. Okay. I do 20 of those. This is now, we're getting close to the end. On the knees with the band, raise up. This is what you have to do. Get your bum nice and high off the floor. You can start like this, hands down, elbows, easier, harder. Feet apart, squeeze together. Think of there being a playing card between your knees when you squeeze them and hold it there. 1, 2, 3, 4, 5, apart. And feel your muscles tighten here. Okay, good one. The clam. Make sure you're trying to get your feet aligned with your back. 1, 2, 3, 4, and 5. Okay. Then I do a standing or a kneeling clam. 1, 2, 3. This is getting near the end. Once you have that done, into an athletic position, knees out, knees out, knees out, knees out, knees out. And you just want to just turn your knees out, strengthening that core. The next one's a side shuffle, and of course, the longer you do this, if you have a hallway, this is ideal. But you want to get into a good position and shuffle across. You start this with no band, and then you can add a stronger band over time. Okay, we're almost there, we're almost there. Blue band at the bottom. Squash move. Step, get your balance. Step, balance. Step, and you step at a 45-degree angle. And pause. 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 That's a good one. Bands off. Here's the hard one. I saved the hard one for the end. This is a carpet slider. A piece of cardboard would work, but you need something that gives you a bit of stickiness on one side and smooth and slidey on the other. This is my physiotherapist Sarah's move, and it's wonderful. Operated hip is here. Go into an athletic position, slide out, come in. Slide out, come in. Slide out, come in. And then the other side of that one is to go slide back, come in. Slide back, come in. And this is the hardest thing that I do. Again, here, slide out, It's asking a lot of the operated hip there. You can see that I don't have the strength there. And then finally back. And then the best stretch you can do, for me, my money, is this one. And you can do this pre-hip replacement, post-hip replacement. Take the injured side, give it a strap, and just pull and stretch. That's it. I hope this helps. If you know someone who is about to have her hip replacement, send this to them. If you've had your hip replacement, check with your physiotherapist on what you should do and when you should do it. And I hope this will help you down the road, and best of luck.